Good evening, everyone. It's 6 p.m. here in California with our first, expert, Dr. Kat Toups. So Kat Toups is an MD. She's a distinguished fellow of the American Psychiatric Association. That's the highest honor. Board certified by the American Board of Psychiatry and Neurology, and previously boarded in geriatric psychiatry. She's also a certified practitioner with the Institute for Functional Medicine. Formerly an assistant professor of psychiatry at UC Davis, where she was the inpatient residency training director and later the founder and medical director of the Bay Area Research Institute, a clinical trials research center in Lafayette, California for 12 years. After serving as the principal investigator on over 100 clinical trials, including 20 failed trials for Alzheimer's medications, she realized that the elusive cure for brain and psychiatric illness was not going to be found in a pill. In 2009, Dr. Toups attended the Food as Medicine, a conference that opened her eyes to the power of nutritional interventions. She learned about functional medicine. It's a paradigm that could help, the patients get really well by working to uncover and correct the root causes of what makes them ill. She went on to complete all of the advanced training for certification at the Institute for Functional Medicine and scores of other functional and environmental medicine training. Her practice is now devoted exclusively to functional medicine, psychiatry, and functional approaches to treating cognitive impairment and dementia. Dr. Toups was a contributing author to the academic textbook, Integrative Therapies for Depression, Redefining Models for Assessment, Treatment, and Prevention, that was published in 2015. She's currently collaborating with Dr. Dale Bresden on a prospective clinical trial using a functional medicine method to reverse mild cognitive impairment and early dementia. That's what it says here. She'll talk to you about it. She's also, the author of the upcoming book, Dementia Demystified, the definitive guide to resurrecting your brain, reversing cognitive decline, and regaining your memory. So that's a mouthful, a lot to say. Dr. Toups, a great pleasure to see you on the show, and I give you the floor.
Thanks so much for having me. Well, I'm always excited to talk about the brain and talk about ways to help our brain. And I'm going to take you on a little romp as fast as I can because there's always so much to say about the brain that it's hard to distill it down in a short talk. But hopefully I'll give you some good nuggets here. In psychiatry, I was trained to specialize in the brain. I had training in psychiatry and neurology and advanced training in geriatric psychiatry, and we focused on treating the diseases that affect the brain. But I was trained primarily about what medication to use for what condition. So the medications could help things, they could help to relieve symptoms, they could help to relieve suffering, but they didn't really cure people or make them well. And so that's the shift that I have now is, how can we understand why are people sick and get them better? So what I've learned from practicing psychiatry almost 30 years now is that the answer to getting well is not going to be found simply by taking a pill. So many traditional folk healers throughout time have known that the body has its own wisdom, it has the ability to heal itself, but we have so many things now that get in the way of our bodies healing and remedying themselves that they need help. So we have to remove things that are injuring them, and then our innate healing mechanisms can get freed up to do what they need to do. So going back to the brain, it's important to understand that unlike my psychiatric training, we were taught in psychiatry that the brain is separate from the body. We only focused on the brain, and it was compartmentalized that way. But what it's turned out is, of course, the brain is very much connected to the body. And so if I want to understand why is the brain struggling, what is going on in the brain, I have to look at the body to understand the source of that. So I have to start by understanding what is inflamed, what is infected, or what is deficient in the body so that I can help people's struggling brains. So I like to think about what I do with the brain, and particularly with trying to halt and reverse dementia. I call it the 3 R's. My job is to remove, replace, and regenerate. So I need to remove the factors that are hurting the body and hurting the brain and weakening the system. I need to replace the nutrients and hormones that the body is lacking or deficient in so that it has the tools that it needs to heal. And then once we've remedied all that and the things that are hurting the brain, then we can take steps to regenerate the brain or help it to regrow or make new neuronal connections to take over from the damage that's been done. So I'll come back to these 3 R's in a little while, but first I want to tell you a little bit about what it might look like if you're starting to have some senior moments, or if you're noticing changes in your memory. Well, I find that people often have an intuitive sense that they're starting to have trouble with their memory. And they might have problems finding the right word. They're struggling, the word's on the tip of their tongue and they just can't find it. Or sometimes even worse, they'll say the wrong word that they didn't mean to say. They might have trouble forgetting people's names that they should remember, or they'll drop a ball or two because they forgot a task they needed to do. Sometimes I find people will forget details of recent travel or important events. They'll start misplacing or losing things. They might have trouble with directions, and they might have trouble even getting to familiar places and find that they start to become overly reliant on their GPS. Sometimes people have trouble with math. They can no longer calculate a tip easily in their head. Sometimes cooking is a good way to know that there's a problem. Cooking is in following a recipe and making everything come together when you're cooking a meal. There's a lot of complexity there. And if that starts to seem stressful, or there's just a global sense of overwhelm that things are feeling harder to accomplish, all of these might be signs that your memory is struggling. So what I find is people go to the doctor and the doctor says, oh, you're fine. It's just normal to have some changes in your memory with aging. There's nothing to worry about. Well, I really want to take exception to that. I strongly disagree with that. And what I find is that when people feel like they're starting to have trouble with their memory, they actually are. We actually have a medical term for this now. It's called subjective cognitive impairment. So it's when you actually think that something's happening, and generally when I test people and look into it, it is. So I have a patient working with me right now in a dementia clinical trial that I'm doing with reversing dementia, as Adiel mentioned. And this patient was tested, I think 4 years ago by his doctor because he started to feel like he had some memory problems. Well, this particular patient is a physician and he's an inventor and he has a very high IQ. And he did okay on his neuropsych testing on all of the categories except for one. And that was his delayed verbal memory, and it was down to the 18th percentile. So the way you think about these percentiles in neuropsychiatric testing is a 50% is average. So here I have a physician with a very high IQ, years of advanced training in medicine and engineering, and I would expect that his verbal IQ would be substantially higher than average, and certainly not in the 18th percentile. So when I saw that, to me, that's a very important clue, right? Something is affecting his brain. So what did the doctor and the neuropsychologist tell him at that time? They said, everything's fine. You're just a little low on one score, nothing to worry about. Try to exercise some more and reduce your stress. So my patient felt reassured and he did nothing. And things continued to decline to the point that 4 years later, fast forward to now, he's in his early 60s and he actually met criteria to be enrolled in my dementia clinical trial. So guess what his worst score was when we did neuropsych testing? Well, you guessed it, it was the verbal memory. So over these past 4 years, that verbal memory had declined from the 18th percentile now down to the 7th percentile. That's pretty darn bad. And now he had other categories in his cognitive testing that had declined as well. So the frustration here is that he lost all this valuable time that he could have been addressing these factors that were driving his neurodegeneration. Because that's what's happening when you're having trouble with your memory, your brain is slowly degenerating. And I want to say, don't be fooled by age. So this physician first presented with these memory problems in his late 50s. And I am seeing dementia. I've been doing dementia research since the start of my career, and it was very rare for me to see people in their 50s when I started, but now we're seeing people presenting earlier and earlier. And I do think this is a response to the ever increasing toxicity of our environment, the pollution, the chemicals, the worsening of our nutrition with all the processed food and the fast food. Also, we become, less and less active physically, and our general stress level is high, especially at a time like this. In my current dementia trial, I have 10 patients enrolled at my site. It's a multi-center trial. We're doing it at 3 different sites, but 5 of my 10 patients are under the age of 65, and one of them is only 58. So if your memory is having trouble, don't think you have to be 75 years old. You would definitely want to pay attention. Okay, so let's go back to those 3 R's, and let me tell you a little bit about each of them in this limited time, and I'll try to weave in some other ideas for people of things they can do to understand and hopefully mitigate their own brain decline, and just make you aware of some of the factors that we can test and we can address. So rather than just simply waiting for your brain to degenerate to the point where it's obvious, we want to find these clues and fix things before you get to that point. And the earlier we find things, the easier it is to restore you to the functioning that you had before. Now, it's never too late. I think it's always a good idea to try. But the longer it's gone on and the more neurons you've got, obviously, the harder it's going to be. So, of course, prevention is going to be our ideal. So the first step, back to my R's, is to remove. So we want to remove the factors that are weakening the body, that are hurting the body and the brain. So whatever happens in the body crosses through the blood-brain barrier, which is a little thin vascular barrier around our brain, and it can travel into the brain, and the same things can happen there. So these are things like infections, like toxins, high blood sugar, inflammation. The toxins can be in the form of heavy metals. I'm seeing so much mercury these days. Unfortunately, our oceans have become quite polluted, and anybody that's eating the larger fish like tuna, we're going to see high mercury. But sadly, I have some patients that come to me and say, I only eat wild-caught salmon. And I had a patient like that with a mercury level of 22. Now, a mercury level above 2 is concern, and 4 is not good, and he was above 20. Lots of chemicals, lead, arsenic, and then there's also all the chemical toxins in our air, in our water, in the products we apply to our bodies that we use to clean our houses, and then even mycotoxins from mold. The mercury is interesting. One of my colleagues presented data on her cognitive decline patients last year at one of our national meetings, and she found that the mercury levels of her patients with cognitive decline were about twice as high as age-matched controls. And she just, looked at the standard age controls and then looked at what was happening with her patients. And definitely the mercury, we know, is one factor that is destructive for the brain. To get rid of high mercury, when I find a high mercury, I ask my patients to actually completely avoid eating seafood for 4 to 6 months, other than scallops and deveined shrimp. Those two are actually the lowest with the mercury levels. So we can see if people stop eating the seafood, the levels can come down. And the other way that we can detoxify from metals and chemicals is sweating. That's very well validated. So if you have access to a sauna, hot yoga, exercise where you sweat, the sweating will actually mobilize those toxins. That's a big detox organ that we have, is our skin, and that can help you to detoxify. Though with the caveat that while you're sweating, like say you're in a sauna, you want to be wiping the sweat off as it comes out. You don't want it to reabsorb, and you don't want, you've worked hard to get those toxins out of there. So wipe it off and go take a shower afterwards to get rid of that. And then, usually with some support, sometimes supplements to help the liver detoxification, then people can resume eating seafood, but go back to what we call the smash fish, the smaller fish that are going to have lower levels. So I want to just say a couple of words about mold. That's a topic of a very long lecture, but suffice it to say that mold can give off these mycotoxins that are neurotoxins. They literally can eat up the brain, and they can cause dementia even in young people. So what you inhale through your nose travels right up through that olfactory nerve, across this little thin bony structure called the cribriform plate, and right into your brain. So anything inhaled that's toxic has the potential to cause problems for our brain. So if you're living in a home that's had leaks or water damage, even if you don't have visible mold, it's useful to consider doing some home mold testing. You can test the dust in your home for mold spores. And particularly if anyone in your house is having memory problem, brain fog, asthma, allergy symptoms, and even unexplained weight gain, sometimes that's a clue for me. One of my patients had been doing well and then had some water damage in her home, and she suddenly started gaining weight for no reason, because the mycotoxins will disrupt the hormones in your brain, in particular the leptin system, and then people can gain weight for no reason. So there's a company that I recommend for the home mold testing called Mycometrics. And I'll have some resources that can be sent with the video for some of the things I mentioned here. But Mycometrics is a company that a lot of the mold inspectors will use for their testing as well. So you can order a test for $150 to $300, depending on how many molds are tested. And you can sample all the molds in your home. And you sample the dust all over your home, and then they test that for the molds. And then when you get that result, you can go to a website called myhousemakesmesick.com, and that will be in the resources. And you put in your scores, and you'll get a general moldiness index for your home. So it's not as good as having a well-experienced mold inspector in your home, but that can be one way to start to investigate if you have some suspicions. And one thing that's important to mention about mold before we go on is it should not be cleaned with bleach. Bleach turns out to aggravate the mold, and then that causes it to give off the spores or the mycotoxins into the air. It's not the mold itself that makes us sick, but it's those spores. So it's best to actually just clean mold with soap and water and scrubbing, and avoid the bleach. So infections in the brain are just a huge driver of cognitive decline and dementia and immune problems. I have a list that's several pages long. I've researched and tried to find every infection that I could find that affects the brain, and it's quite long. Some there's plenty that are kind of the more common ones that we can test for those easily at Quest and LabCorp, things that are covered on people's insurance. And we have treatment protocols for some of these infections and viruses. Some of the common ones are Epstein-Barr virus or EBV, herpes simplex 1, herpes simplex 2, HHV6, which is another kind of herpes virus, and HHV7, toxoplasmosis, mycoplasma, and Lyme disease. So all of these critters, they like to live in our brain tissue. And when they do autopsies of people that have died with Alzheimer's, they'll find these kind of organisms at much higher levels than in people that didn't have Alzheimer's. So it's an indirect correlation there, but we know that when you get an infection in the brain, what is it going to do? It's going to trigger your immune system. And then the immune reaction is what causes the damage. When our immune system gets activated, it releases inflammatory cytokines to kill these invaders, but it will kill some of the other tissue. So we definitely would like to keep these infections down to a dull roar. Now, what happens with aging is it's often accompanied by a decline in our immune function. And this is the worry right now with the coronavirus, right? That people say the elderly are more susceptible because their immune systems are not as good. That's just part of one of the factors with aging. And the immune system can also decline just from stress. So what happens is, like the viruses that I mentioned, they don't go away, they actually stay within us, but our immune system keeps a lid on it, it keeps them in check. But when our immune system is compromised in any way and not so effective, these viruses can wake up, they can reactivate, and they can start replicating or multiplying again. And that's when we can have destruction and get into trouble, and then this can result in neurodegeneration. So the first step to prevent this is to strengthen and fortify the immune system. And to do that, it's the same foundation that's useful for any kind of disease, any kind of general wellness. You need to eat well, sleep well, and exercise or move your body. There's no way you can be healthy by eating processed food and fast food, and it is fat food too. And then just taking vitamins, that doesn't cut it. So in addition to, starting with what you're eating for your immune system and your general health, in addition to eating, fresh whole food, I think it's really important to reduce the carb content of your food. I like to tell my patients to visualize this equation. See it in your head. Carb equals sugar. It's the same thing. Carbs break down the sugar. And we were told, certainly all my life growing up, you need to eat lots of, healthy whole grains. That's what's healthy for us. Well, now people say that this might be the biggest medical mistake of the last century. And why is that? Because the glycemic index of these grains are really high. The glycemic index is a measure of how much sugar an item has relative to table sugar. And it turns out that whole wheat has a glycemic index that's actually 20% higher than table sugar. So I like to tell my patients, if they want to eat a big fluffy bagel, it's like they're eating almost 2 candy bars worth of sugar. Well, we know that sugar is toxic for our cells, it's toxic for our blood vessels, and it's toxic for our neurons. Sugar is not an essential element. We don't need to have sugar. And of course, too much sugar and carbs leads to obesity, which has become another huge epidemic in our population. And the obesity causes all kinds of, subsequent problems: high blood pressure, diabetes, sleep apnea, heart disease, and brain disease. So when people carry excess fat, the fat secretes its own inflammatory cytokines. And this is why it's very hard for people to lose weight, because there's this high level of inflammation. So it takes steps to reduce the inflammation. It's not a calories in and calories out formula. That isn't what's going to do it. You need to be able to reduce the inflammation. And so it becomes a vicious cycle, because when you already have extra fat, you secrete more cytokines, which leads to more obesity. So one of the ways to stop that cycle is to start with your food. I ask all my patients to avoid gluten at a minimum, which is the grain that has the highest glycemic index. It's also our most common food allergen, and it raises a protein called zonulin in the lining of the gut that actually promotes leaky gut. So it's quite a different type of food than we had in the ancient wheat, and for most people, I think the trade-offs of as good as it tastes, it's not worth it for the health risks. My preference, especially when people have brain disease and neurodegenerative disease, is that they avoid eating all of the grains because of that high sugar content. So I like to recommend lots of fresh organic veggies, a small amount of fruit, and a small amount of free-range meat, chicken, eggs, wild-caught fish. And I like them to pour in the healthy fats. Now, why is that? Think about the brain. The brain is mostly fat. Think it's that spongy material. It's made of fat. It's 60% fat. And then we have the nerves in our brain, and around each nerve is a coating that's called the myelin sheath. And the myelin sheath protects the nerve and helps it to send impulses from one nerve to the other, like an electrical current. So that's made of fat as well. And what happens is, if we don't have enough fat, the brain will degenerate. And actually, each neuron, the cells of the neuron have a phospholipid layer that's also made of fat. So we need to have enough fat for these building blocks for our brain and our neurons. Now, cholesterol is a healthy fat, and it's been demonized in our last century to eat low fat and eat high healthy whole grains. But cholesterol is actually not only a component in our brain and our cells and our neurons, but it's the precursor to all of our sex hormones, our stress hormones, and even our thyroid hormones. Now, all of those hormones are vitally important for the brain. So if you don't have enough healthy fats in your diet, your brain is going to suffer. And we're now seeing dementia in people that have been treated with high doses of statin medications. Statins are given when people have high lipids to help bring the lipids down. And lipids, of course, have their own dangers, but we can't afford to bring them down too low and starve off the brain. And what I find in my patients, even when they come to me with high lipids, we're able to manage that with dietary changes, with intermittent fasting, with lifestyle modifications, exercise, meditation, good sleep. There's so many ways that we can bring down those lipids. And yes, sometimes medication might be needed when things are dangerous while you work on all of those things, but it's certainly a trade-off. We need to be careful with medicines that lower our cholesterol. So cholesterol isn't the enemy. It's easy now. We can run lab panels of advanced lipids. And these are different than the traditional panel that most of you know. You check your cholesterol, your triglycerides, your HDL, your LDL. But now there's all these lipid subparticles that can predict health or disease. And so those can give us a lot more information about how, what needs to be done to help stave off the heart disease. Also, I have really good data showing that cholesterol levels between 200 and 240 actually have the lowest all-cause mortality. So what that means is you're least likely to die of anything if you have a cholesterol in the range of 200 to 240. And traditionally medicine said above 200 was too high. Well, I just need people to remember the cholesterol is a good fat. And if some of your other lipid subparticles like your Lp(a) or your ApoB are too high, that's a different factor than the cholesterol. So what does it mean when I say eat healthy fats? The healthiest fats are coconut, and that could be coconut oil, coconut milk, avocados, olive oil. That's kind of the top tier of clean fats. And then there's free range meat, chicken, and wild caught fish. And the free range meat needs to be emphasized. The feedlot beef is actually very high in omega-6 fatty acids, which are pro-inflammatory, and they're low in omega-3s, which is what's in fish oil that's anti-inflammatory. But when you look at the composition of the free-range meat that's been fed a native diet that isn't grains to make them fat and inflamed, they turn out to be very high in the omega-3s and low in the omega-6s. So that's the kind of fat we want to be eating. And then also nuts and seeds are nice, clean fats to have in your diet. And so these become the basis for generating fuel for the body, the fats. So when you deprive your body of carbs, it adapts by burning the fats as fuel. And that's really the basis of what ketosis is. Now, you don't have to be in ketosis where you have so few carbs that your body switches to completely burning fat instead of sugar, but you can still benefit from a low carb, high healthy fat diet. Now, we do find that some people with dementia and mild cognitive decline, they do experience an increased clarity of their thinking, and that sometimes people will have a lot more energy when they're in ketosis. So we're actually, in the dementia clinical trial that I'm doing right now, we are requiring that people be in ketosis. But you know, there's no one diet for everyone. Ketosis isn't right for everyone, but just thinking of the lowering your carbs and raising your fats is a healthy way to approach things. Now, another factor that's so vitally important for our immune system and our brain is sleep. And while we sleep, our bodies both detoxify and restore themselves. Our brains, sorry, I mean, our body does too, but our brain in particular. Now, we discovered only very recently that we have this complex lymphatic system in our brain. And that lymphatic system, just like in our body, is for detox. It helps to dispose of the waste products in the brain. And this was just unknown until, well, I think about 2 years ago. It's called the glymphatics. Instead of the lymphatics, it's glymphatics. And it's such a fascinating mechanism. So when we sleep, the brain tissue actually kind of shrinks, and the fluid that's in the ventricles, the cerebrospinal fluid, expands, and then it starts churning around just like a washing machine, and that helps to like clean out the particles and let them get excreted from the brain. So all of the accumulated insults of the day can start detoxifying while you sleep. So here's the problem. If you're chronically not getting enough sleep, then you could be building up an excess of toxins that are doing harm to your brain. And if you miss an hour here or there, okay, that's not a big problem. But if you're sleeping 6 hours every night, that means that you're getting 17 hours less detox a week. And think how quickly that adds up. It's 60 hours a month or 730 hours a year that you have deprived your brain of detoxification. Now, sleep apnea is another big pitfall and danger for our brains. We worry when somebody has a seizure that they're temporarily not getting oxygen to their brain, but when you have sleep apnea, it means every night, all night long, you're not getting enough oxygen to your brain. So the two organs in our body that require the most oxygen are our heart and our brain. And the brain will really suffer if you have sleep apnea. The neurons will start to atrophy and your brain will degenerate. Not to mention, it also puts a tremendous strain on your heart. And untreated sleep apnea can lead to heart failure. So I test all of my patients for sleep apnea. I have a nice home sleep study device. It uses a high intensity pulse oximeter and measures heart rate variability. And I have my patients do that like 3 or 4 nights in a row, because sometimes I'll see 2 nights that come back totally normal, and then I'll see 1 or 2 nights that are not good. So contrast that with going to a sleep lab where you stay overnight. It's cold, it's uncomfortable, you're hooked up to wires. It's not a very real life situation. And most of those sleep labs do offer these home sleep studies. So if your doctor orders a sleep study, you can ask if you can do the home version. I also want to mention, typically people think of sleep apnea as a man that's stocky, that might be overweight, or has a thick neck that's compromising the airway. But I find sleep apnea even in thin women. So you don't have to be overweight to have sleep apnea. One brain infection that deserves a special mention is Lyme disease. Lyme disease is a biggie in the infection world with regard to the brain. So Lyme disease is related to syphilis. And many of you might recall in the old days before antibiotics, a man would have a sexually transmitted disease and it would seem to go away. And then some years down the road, they would go crazy. And it turns out that Lyme disease and syphilis are both spirochetes. They're the same type of organisms, and they both like to live in the brain. Some people with Lyme, it attacks the joints, and other people, it attacks the brain and the immune system. So that's turning out to be another big factor with dementia, and turned up in quite a few patients in my clinical trial that they actually were having active Lyme disease and they had no idea. Now, obviously, it's going to differ in parts of the country, but here in California, we have it in every county of the state at this point. So I rely heavily on testing. And my job to help the brain is I test everything that I can find that is going to give me a treatment target that I can fix. So instead of saying, okay, you have early dementia, try this medicine that won't cure you, go get your affairs in order, come back later when you're worse and still have nothing to offer. What I do is I roll up my sleeves and I start testing everything I can and I fix everything I can. Because if we only fix some of the problems and we don't fix all of them, then the brain will still be under attack. So that's the first R. The second R is to replace. So we need to replace the nutrients and the hormones that the brain and the body are lacking and they need to heal. There's many, many critical nutrients, and I test quite a few, but I just want to mention two of them that are easy to test, easy to fix, and so, so important. And that's vitamin D and vitamin B12. So vitamin D is really a hormone. It has receptors all over the brain and in multiple parts of the body. And it's reported that at least 40% of us, including our children, are deficient in vitamin D. And when you have low levels of D, you have significantly faster decline in your memory and your general cognitive function with aging. Studies have shown that if your vitamin D level is less than 30, which is the cutoff of normal, it can increase your risk of Alzheimer's by 53%. And if your vitamin D is less than 20, it goes up to 125%. And I routinely find people that are less than 20. So this is very easy and inexpensive to test and to measure. And I do not want my patients to be at 31. The range is 30 to 100. You don't want to just be at the bottom of the range. You want to try to get to the middle of the range or a little higher to optimize that. So I shoot for a range of 50 to 80. And different people have to take different doses depending on their genetics. I would say most of my patients are actually on 5,000 to 10,000 IUs a day of vitamin D, but a few of them need 2,000.
Dr. Lou, I can just sit here and listen until midnight because every sentence is great information, but we're going to have to wrap up the show. I want to thank you so much for the fantastic information. How can people reach you if they want to reach out to you?
Yes, so much more to say. Let's see. I'm going to have a handout with some resources that we can send with the recording. People can go to dementiademystified.com, which is my website, or they can find me on Facebook. I have a very active Facebook group where I try to post lots of interesting and helpful information about the brain. And it's just my name, Toups, MD, Functional Medicine, Psychiatry, and Dementia. So those would be two good ways to find things out. And then I'll be, posting in those places when I get the book finished, because there's so much more to say on this that I would like to be able to share with people. But I'd like to just conclude by asking people to just take this message home. Dementia is not a death sentence. So there's ways to prevent it. There's ways to fix it. There's ways to heal our brains. And I think not enough people understand that yet, but it's happening.
Thank you very much, Dr. Toups.